Mr. My question is around the HSE plans around long COVID clinics, and will they be more focused on holistic neuro-focused multidisciplinary issues around the issues of long COVID?
For the question, Deputy. And despite all of the progress in relation to COVID, I am very aware that long COVID is causing a great deal of suffering for people across the country. And we heard some testimony, I don't know if you heard it this morning, on Morning Ireland, indeed, from people who were suffering from long COVID. We also did hear, though, from the clinical leads in terms of what's happening, and it's very clear that their services are being put in place as they must be. So to ensure that people who do need the care get it, the HSE has developed the plan for long COVID nationally services, and they're being rolled out at the moment. The model of care provides a framework for how the services are designed and delivered. It has a holistic focus on service delivery provided through the GPs, through community-led interventions, and then the specialist consultant-led clinics where that's appropriate. The investment in the service has trebled this year, so we are taking it very seriously. And to date, 6 new long COVID clinics have been established, as well as 6 new post-acute COVID clinics, and there's 2 further post-acute clinics due to become operational shortly. As well as that, there's a dedicated neurology clinic that's been established in St James's to provide the specialist assessment, diagnostics, treatment planning for patients who have persistent symptoms. That was being referenced by the clinical leads this morning. It's a consultant-led service. That we have a consultant neurologist there, and in addition, the HSE, as you'll be aware, has developed online resources for self-management of symptoms, and critically as well, additional training for healthcare workers, including for GPs who are now trying to support their patients. Recruitment is ongoing to fully staff up the new long COVID service. Staff include consultants in infection diseases, respiratory medicine, psychiatry, neurology, as well as health and social care professionals and clinical psychologists. And in total, an additional 40 staff, or 39.4 staff, have been recruited to date, and further recruitment is underway.
Yes, Minister, and obviously we welcome that. And there's a conference, I think, today on long COVID, and I think we're only understanding the evolution of long COVID, and those that have been really debilitated by it. And it's extremely debilitating, to say the least. I think we probably all know people that have long COVID, and it has changed their life to a certain circumstances, and it has put their life on hold. Somebody that was completely healthy, that had got COVID, now is a situation where their life has changed. But the good news is that the vast majority of people will recover from long COVID, the vast majority. But people that are in that situation want to access the best intervention as possibly think you can do, particularly around obviously respiratory, but not just only respiratory, but also cognitive impairments, which is one thing I think sometimes it's lost in all the the intervention that we're talking about around non-COVID.
Yeah, thanks, Deputy. I agree with you on all of that. The good news, as you say, is for the vast majority of people, a relatively short amount of rehab and health support leads to full recovery. I've met patients whose lives have just been turned upside down. I've met patients in my own constituency. I've met patients in Tala who are being treated in the long COVID clinic there, and they're just devastated. They've gone from healthy, active people, in cases, healthy, active, mums and dads, to just not being able to get up the stairs, not being able to get to the shops. For those who it affects badly, it can be absolutely devastating. It's an evolving area, obviously. HICWA did a very thorough review last year to inform the model of care that we're putting in place. But this will be an evolving area. The HSE has a new survey in place, and the European Commission is also putting together a high-level informal network so that member states can learn from each other and update the service provision to people as we learn more.
Welcome, Minister. I think it's, as I said, I think it's important that the state kind of recognise that long COVID is very prevalent, and the vast majority of people, they will have a full recovery as long as they get the intervention. That's the most important thing. And I think, but just one of a major concern is in relation to waiting times, in relation to those that are suffering from long COVID. I think at the moment there could be up to a year before they can actually get their intervention, which is probably not good at all, because the evolution of long COVID, it can last longer than even like a year, but generally the symptoms, if somebody's going to make a full recovery, will probably just go beyond 9 months to a year. That's generally the kind of the trend of long COVID, but the waiting times is a huge concern in relation to those that want to access them kind of multidisciplinary, I suppose, interventions that they should receive.
We don't want anybody waiting long for this, for the obvious reasons. And part of what we're doing now with these new clinics around the country, staffing them up, we'll have 14 clinics, and then the St. James's facility as well. And remember, people can also get initial treatment from their GP, which is an important message. But where more specialist care is required, we're putting these new services in place. They're still hiring up, and so we want to, and our aim is to put in enough capacity that we can make sure people get quick access. Just for reference, Deputy, the long COVID clinics we have in place now are in St. Vincent's, Beaumont, Galway. The post-acute clinics are Galway, The Mater, Connolly, and then we have combined ones in Tala, James's, Cork University Hospital, and then there's 2 more coming, which I believe are in Limerick and Letterkenny.